morning, everyone. Today's class, we will discuss about the calcium channel blockers. That is mainly the 1,4-dihydropyridines. That is mechanism of all the classes of 1,4-dihydropyridines as well as the other verapamil, diltiazem, and other related compounds. So coming to the mechanism of action of the calcium channel blockers. Okay. See, the calcium channel blockers are all the calcium channel blockers which we have are all the antagonists of antagonists, and they are used as vasodilators. Then this vasodilation of calcium channel blockers is mainly due to the uh, uncoupling of contractile mechanism of vascular smooth muscle, which requires calcium ion. As we know that calcium is an important ion in the muscle contraction, that is the myosin and actin fibers activation, and then leading to the constant contraction of the smooth muscle. And this smooth muscle, particularly in the vascular smooth muscle. So if you are able to inhibit the availability of calcium ions at the uh, contractile, that is the vascular smooth muscle, then automatically there is no contraction and no spasm in the vascular smooth muscle. So the main important part, coronary artery muscle tone is reduced in healthy humans, but is particularly pronounced in a condition of coronary spasm. So in coronary, people with coronary spasm are more affected than the normal people. Okay. Then coming to the peripheral part, that is at the peripheral region. Okay. So at the peripheral region, we have the periphery. One minute. So the peripheral arterial the peripheral uh, arterial resistance is reduced more than the venous blood. And the next effect is the vasodilatory effect of these drugs is the basis for their use in the control of angina and hypertension. So they can be used both in the treatment of angina and as well as hypertension. The phenylalkylamine examples, that is the verapamil, and the benzothiazine class example, diltiazem, have both cardiac and vascular smooth muscle actions. And these drugs have the anti-arrhythmic, anti-anginal, and anti-hypertensive activity. So these phenylalkylamines and as well as the benzodiazepines, that is the verapamil and diltiazem respectively, have got three effects. That is the anti-arrhythmic activity, anti-anginal activity, and anti-hypertensive activity. Then the calcium channel blockers do not simply plug the hole. So the unlike the diuretic agents, some of the diuretic agents which we have, amiloride and triamtrin, which have the effect of plugging the channels. But in case of these calcium channel blockers, they are not mere plugging the hole of the calcium channel, but physically block the calcium channels. Okay. So how this mechanism of blocking the calcium channel is done. Okay, so if it is not the plugging the hole, how do they affect the, or how do they inhibit the availability of calcium into or in the place? So they exert their effects by binding to specific receptor site, which is located in the central alpha subunit of L type. So in the beginning of the previous class, we have discussed about different types of calcium channels. We told that there are nearly 9 types of calcium channels. Of those, the 4 important ones we have seen. In that, the calcium channel blockers mainly act on the L type of alpha subunit of the calcium channel. And then the potential dependent channels. So these are potential dependent channels. So three distinct but allosterically interacting receptors have been identified for the different classes. That is the verapamil, the then diltiazem, and 1,4-dihydropyridine derivatives. That is the amlodipine, nifedipine, then nimodipine and all. So all dipines come in this category. That is 1,4-dihydropyridines. Okay. So by this, what we can say that, you see, when you say allosteric, that means these 3 types of, or 3 categories of the calcium channel blockers do not act at a particular active site of the L type calcium channel, but they act at 3 different sites. Okay, that is why we call them as allosteric site is when one of the drug attaches itself on a particular or its respective site, then the other sites which are being attacked by the other 2 drugs or other calcium channel blockers are being affected. That's why these sites we call them as allosteric site. That is, if the active site of one compound, when it attaches, then the active site for other compounds is being affected. So here I've just drawn a diagram for your simplification of the mechanism of these 3 sites. So let us imagine there are the this is an imaginary diagram for you to understand. So there are 3 sites, that is the site for verapamil, then the site for diltiazem, and the site for 1,4-dihydropyridines. So when verapamil binds to its binding site, that is site 1, then when this site is occupied by the verapamil, then there is a change in the site of the 2, that is the diltiazem and 1,4-dihydropyridine site, and these sites are modified in such a way that if diltiazem and 1,4-dihydropyridines, that is amlodipine and related compounds, are present, they cannot bind to their respective sites. So here what we have written, so when verapamil binds to its site, then the diltiazem and then 1,4-dihydropyridines cannot bind to their respective sites. So that is what we have shown here. And then coming to the second condition. So if diltiazem or the 1,4-dihydropyridines, that is amlodipine, nicardipine and all, if they bind to their sites, that is 2 and 3, either of it, that is either diltiazem binding to each site or 1,4-dihydropyridines binding to its sites. So what happens is the verapamil active site is being modified and it cannot accept verapamil at the site 1. Okay, so that's why we have written here the verapamil is out, and then the 1,4-dihydropyridines and as well as the diltiazems, and they bind, the verapamil cannot bind to its site. Okay, that is what we have shown here. And then coming to the next part, that is the other condition. So the other condition is when, so we have seen verapamil and verapamil versus diltiazem and 1,4-dihydropyridines, and the third condition is, that is the when verapamil is absent and only diltiazem and 1,4-dihydropyridines are present, that means See these site 2 and site 3, they are mutually benefiting each other. That is mutually enhance the binding of each other. So that means diltiazem, when it binds to its active site, then it favors the binding of the 1,4-dihydropyridines also. So that's why we have written here, I have just shown a love symbol, that is they love each other and then they favor each other binding sites and they mutually benefit each other. And coming to the next part, the 1,4-dihydropyridines are primarily vasodilators, whereas verapamil and diltiazem have both vasodilator and as well as cardiodepressant activity. That means not only acting on the blood vessels, it also acts on the cardiac muscle. So that we have to remember. So here verapamil and diltiazem have got both vasodilator and cardiodepressant activity, whereas on the nifedipine, that is which belongs to 1,4-dihydropyridines class, have got only vasodilator activity. Then the increased heart rate seen with nifedipine. See, all these drugs which we are using should reduce the blood pressure and should also to some extent reduce the heart rate. But when nifedipine is given, it results in the increase in heart rate. Okay, this is due to a reflex mechanism that tries to overcome the vasodilation and subsequent drop in blood pressure. So whenever there is administration of nifedipine, then we see vasodilation and the reduction in blood pressure, but the mechanism within the body will try to increase the heart rate, that is increase for the compensatory drop in blood pressure and vasodilation. Thereby it may increase the heart rate, which is not a desirable one. But in contrast, the compensatory mechanism does not occur to the same extent with that of the verapamil or diltiazem. So remember the above said points, that is binding of verapamil and then allosteric change in the allosteric sites of diltiazem and 1,4-dihydropyridines. You can expect at least one question from the in the GPAT, the competitive exams. And similarly, this is another point that you should remember, which can be asked for a GPAT question. So which of the drugs are responsible for increasing heart rate? Okay, so then you will have to say that it is the nifedipine or 1,4-dihydropyridine class. Okay, right? Then the coming to the metabolism. Okay, so the metabolism of these class, mainly 1,4-dihydropyridines class. Okay, so the metabolism include, that is oxidation of 1,4-dihydropyridines. So as we know that the see the this is the one example that I have taken here. So nifedipine is the example. This is the structure of nifedipine and it belongs to 1,4-dihydropyridine class, and this is the ring of 1,4-dihydropyridine ring. So it is being catalyzed or oxidized by the enzyme CYP3A4. So please remember, this is also another important question can be asked. So what happens? These enzymes will oxidize the nifedipine, which is an active calcium channel blocker, to inactive compound. So the oxidized form of nifedipine is inactive. Okay. Then what is the changes that have undergone in the metabolism? So if you look into this structure of the 1,4-dihydropyridine in nifedipine has been converted into a complete pyridine ring. That means there is removal of hydrogens. So removal of hydrogens is by definition, it is oxidation. So here the oxidation of the 1,4-dihydropyridine ring has taken place and it has turned into, or it has transformed into the pyridine ring. Then, so coming to the other compounds. So what are the metabolites? And in case of the nifedipine, the metabolite is inactive, but in case of other categories, that is if you look into the drug nisoldepine, So nisaldepine will undergo hydroxylation. Okay, so the substituents have got a long chain of alkyl chains. So at this omega or omega minus 1 or minus 2, so whether the possibility is there, it will undergo hydroxylation, and the metabolite, the hydroxylated metabolite of nisaldepine has got the activity of 10% of the parent compound. That is, the metabolite has got still active, uh, which is of 10% when compared to the original molecule, that is nisaldepine. Then coming to the next compound, that is co-administration of 1,4-DHPs, any of the DHPs, that is the amlodipine, phenodipine, then nicaldipine, nimaldipine, all dipines. So with grape juice will produce an increase in systemic concentration of 1,4-dihydropyridines. So as the concentration of these, why does the concentration of 1,4-dihydropyridines increases with the increase in if you co-administer with grape juice? That is, the grape juice inhibits CYP450 enzyme in the intestine and prevents the conversion of or metabolism of these 1,4-dihydropyridines. So when the metabolism of 1,4-dihydropyridines is reduced, automatically there is larger amount of compound or 1,4-dihydropyridines available in the blood. Thereby it leads to the higher concentration in the blood. Okay. So this is one more GPAT question that can be asked. Okay. So 1,4-dihydropyridines, if given along with the or co-administered with the grape juice, their concentration increases. That is, systemic concentration of 1,4-dihydropyridines increases. Okay, that is the important point. The next is this is also another important question that can be asked. Okay, so verapamil is metabolized to N-demethylated compound. Okay, so verapamil is metabolized into N-demethylated compound, which is called as norverapamil. Okay, so this norverapamil has got 20% of activity when compared to that of verapamil. Okay, so then, so here we can say that norverapamil is 20% as active as verapamil. Then this verapamil exists as isomers. So that is the S isomer and as well as R isomers are possible. Okay. So here the more active one is the S isomer, which undergoes more extensive first pass hepatic metabolism than the less active R isomer. So this is also an important question that you will have to remember for the competitive exams. Okay. Then coming to the next part, that is the other compound which is left out in calcium channel blockers is the diltiazem. So this diltiazem is hydrolyzed, okay, into diacetyl diltiazem. That means removal of acetyl group COCH3 is acetyl group. Okay, so the removal of acetyl group is called as the compound which is formed on removal of the acetyl group is called as the diacetyl diltiazem. Okay, so here the metabolite that is formed is diacetyl diltiazem, and this metabolite diacetyl diltiazem is 25 to 50% is 25 to 50% as active as the parent compound, that is the diltiazem. Okay, so it has got 25%, 25 to 50% of the coronary vasodilation effects of the parent molecule diltiazem. Okay, so this is the metabolism of calcium channel blockers and as well as the mechanism of action of calcium channel blockers. So we will end here.